Hello, welcome to any community. Today we are going to start with a new topic, that is what is called electrocardiogram. One such topic which most of the Ayurveda students are not aware of. So we are going to discuss the why electrocardiogram is necessary. So as far as the indications of electrocardiogram are concerned, first of all, we need to know about what actually this electrocardiogram refers to. It is a diagnostic tool, an inexpensive tool, which is helpful in the diagnosis of cardiac diseases. So in terms of the trivial cardiac disease, such as the right atrial enlargement, etc., are related to the most severe cardiac disease, that is what is considered to be myocardial infarction or acute myocardial infarction or otherwise acute coronary syndrome. So when you think about the initially where we are going to do the electrocardiogram, when a person is presenting with palpitation, so that is while seeing something uh, fearful situation, he will be having the fearful, that is the palpitation, that is awareness of one's own heartbeat is common. But even in some situations where the person will not be having that kind of the fearful situation, even on the normal situation, if the person is developing the awareness of one's own heartbeat, probably that may indicate palpitation. In that particular situation, we are going to give the, what do you say, that the advice electrocardiogram. Suppose if the person is presented with chest pain, retrosternal chest pain, radiating towards the left shoulder, sometimes up to the fingers. So the character of the pain will be as if the heavy uh, object is being put over one's chest. For example, elephant's feet, etc. So that means heaviness of the chest, aggravated by climbing the stairs, or otherwise in the cold climate, or taking the heavy meals, etc. That is indicative of the cardiac chest pain. In that particular situation, when the person is giving the history of this kind of the nature of chest pain, then we are going to suggest electrocardiogram. In some of the occasions, the person may present with pain in the epigastric region. So this will be mimicking the alimentary canal dysfunction itself. But to rule out specifically inferior wall myocardial infarction, so we are going to prefer to do electrocardiogram. Or otherwise, the person is presented with cyanosis or bluish discoloration of the tongue or lips, etc. This may indicate major cardiac disease or respiratory disease. If the person is having the cardiac disease as such, major cardiac disease, definitely, so that will be presented with, what do you say, that the central cyanosis as such. In that particular situation, we are going to suggest electrocardiogram. Or otherwise, when the person is presented with giddiness, or whenever he is sitting, he will be having the giddiness, and whereas if the person is sleeping, that sleeping posture, this may not be there. In that particular situation, we are going to assume the person may be having the syncopal episodes. In that particular situation, we are going to advise electrocardiogram. Here, that is being mentioned syncope. As such, what do you mean by syncope? Where the reduced blood supply will be happening into the brain due to the poor cardiac dysfunction. And whenever if a person is presented with the chest pain, he is already being diagnosed that he is having the acute coronary syndrome, such as myocardial infarction, or acute IHD as such, or angina pectoris. In that particular situation, we are going to do the repeat investigations, that is electrocardiogram, specifically in cases of myocardial infarction, to know about the progress of the treatment. That means as a response to the treatment received when the person is having the diagnosis of myocardial infarction, in that particular situation, we are going to do the repeat electrocardiograms. So when you think about the congestive cardiac failure, this is considered to be one of the electrocardiographic, that is the indications are there in this particular occasion. So when you think about congestive cardiac failure, what do you mean by this particular congestive cardiac failure? So here it's a schematic representation of heart, wherein the right atrium is connected with the superior vena cava and inferior vena cava, whereas the left atrium is being connected with the pulmonary veins, whereas right ventricle is being connected with the pulmonary trunk, and left ventricle is being connected with aorta. So that means the blood will be coming from superior vena cava and inferior vena cava to the right atrium. From there, it will be entering into the right ventricle. From the left ventricle, the deoxygenated blood will be entering into the pulmonary trunk. From there, the oxygenation of the blood will be happening in the pulmonary capillaries. From the pulmonary capillaries, the oxygenated blood will be entering into the pulmonary veins to the left atrium. From there, it will be entering into the left ventricle. From there, the blood will be entering into the aorta. This is the normal circulatory mechanism. If the person is having the atherosclerosis in the aorta, or if the person is having the aortic stenosis, where the diameter of the aortic valve is going to get reduced, in those situations as such, what actually happens is the complete emptying of the blood from the left ventricle to the aorta will not happen. This is leading to the accumulation of the blood in the left ventricle. This is being termed as congestion. When the congestion is happening in the left ventricle, so what actually happens is the complete emptying of the blood from the left atrium will not be happening. So that means there will be congestion in the left atrium too. If the congestion is happening in the left atrium, this will be leading to the incomplete emptying of the blood from the pulmonary veins. So that means the congestion will be happening in the pulmonary capillaries too. This will be leading to the backflow of the blood from the pulmonary capillaries to the pulmonary trunk. This will be leading to the congestion happening in the right ventricle, which in turn leads to the congestion to happen in the right atrium, which in turn results in the backflow of the blood to the superior vena cava and inferior vena cava. So like this, the whole mechanism, what we can say, that is the congestive cardiac failure. This may be presented with either congestion may happen in the one chamber, congestion can happen in the two chambers, congestion can happen in the three chambers, congestion can happen in all the four chambers of the heart. The mechanism will be the congestive cardiac failure as such. In that particular situation, the electrocardiogram may help in the diagnosis. Suppose if the person is having the mitral valve dysfunction, which can be identified by the systolic murmur that is present on the mitral area, which is radiating towards the left axilla, which is indicative of that. In that particular situation, if you are going to do the electrocardiogram, then there may be a possibility of a left atrial enlargement can be possible. Suppose if the person is having the murmur which is radiating from the mitral area to the right sternocleidomastoid region, in that particular situation, the probable diagnosis can be made will be aortic stenosis. In that particular situation, if you do the ECG, we may get left ventricular hypertrophy that may lead to left atrial enlargement. In case of a mitral valve dysfunctioning, there may not be left ventricular hypertrophy, but there will be left atrial enlargement. The same thing can be predicted with the tricuspid regurgitation as well as the pulmonary valve dysfunction or pulmonary stenosis as such. So, in this way, so the congestive cardiac failure can be diagnosed with the help of electrocardiogram. And when you think about the other systemic diseases as such, for example, if the person is having anemia, this will be leading to the more and more burden to the left ventricle itself. So that means the person may have left ventricular hypertrophy in that particular situation. If the person is having hyperthyroidism, this may be associated with hypertension. That means this may be presented with left ventricular hypertrophy may be present. If the person is having already essential hypertension, so then left ventricular hypertrophy may be present. In case of the person who is suffering from rheumatic fever, there may be a possibility of mitral valve dysfunction. So that means there may be a possibility of left atrial enlargement rather than left ventricular hypertrophy. In case of vitamin B1 deficiency, wherein the person may be having the wet beriberi, in that particular situation, we are going to get congestive cardiac failure features. In cases of chronic respiratory obstructive diseases or chronic obstructive pulmonary diseases or COPDs, there will be the involvement of right side of the heart as such. So that means there may be a possibility of right ventricular hypertrophy and there may be a possibility of right atrial enlargement. In cases of pericardial diseases, such as pericardial tamponade or pericardial effusions, there will be the height of the or deflections of electrocardiogram will be smaller. So in this way, pericardial diseases can be diagnosed. To know the type of the arrhythmia, for example, sinus tachycardia or sinus bradycardia or sinoatrial block or atrioventricular block or complete heart block or right bundle branch blocks or left bundle branch blocks, etc., can be diagnosed by looking into the specifically rhythm strip of electrocardiogram. To sum up, so the conditions where we are going to do electrocardiogram are when the person is presented with palpitation, when the person is having the dizziness or giddiness, when the person is having the central cyanosis, so that means the bluish discoloration of the tongue, lips, etc. And when the person is having acute chest pain, that too retrosternal chest pain, worsening of the pain while doing the exercises or climbing the stairs, etc. And relief of the chest pain is happening by taking the rest, etc. And if the chest pain is persisting for more than 30 minutes, in those situations, we are going to do electrocardiogram. Further, when the person is presented with a syncope, so that means the unconsciousness in the sitting posture and worsening of this particular unconsciousness while giving the pressure on the carotid sinus. In those situations, then we are going to do the electrocardiogram. In cases of poisoning cases, we are going to do electrocardiogram. When the person is having bradycardia, wherein heart rate will be less than 60 per minute. In cases of tachycardia, when the heart rate is 100 beats per minute. When the person is having murmur, either systolic or diastolic murmurs. In cases of shock, where the person is having the reduced input of the blood into the heart and reduced output also in those situations. That means circulatory shocks or hypovolemic shocks. When the person is having hypotension or hypertension, we are going to advise electrocardiogram. When the person is having the possible history of ischemic heart disease or myocardial infarction, when you are suspecting the chamber enlargement, so either there may be a possibility of one chamber enlargement or two chambers enlargement or three or all the four chambers of heart enlarged. In those situations, we are going to do ECG. In case of pericardial diseases such as pericardial effusion and pericardial tamponade, we are going to do ECG. In cases of electrolyte imbalances, specifically hypokalemia, where the concentration of the potassium is less in the blood. Hyperkalemia, where the concentration of potassium is more in the blood. In cases of systemic diseases which are afflicting the heart, for example, rheumatic fever, where the most common part of the heart afflicted will be mitral valve as such. In cases of anemia, left ventricle will be at more stress. In case hyperthyroidism, where left ventricle will be at stress again. Vitamin B deficiency, that is B1 deficiency, where in cases of wet beriberi, which are having the features of congestive cardiac failure. When the person is receiving the treatment of myocardial infarction, to know the response of the drug, we are going to repeat the electrocardiogram to detect the type of arrhythmia. So, what kind of the arrhythmia is there? Whether is it sinus arrhythmia or sinus bradycardia, or sinus tachycardia, or right bundle branch block, or left bundle branch block, or sinoatrial block, complete heart block, etc. We are going to do the electrocardiogram. As a pre-operative assessment in case of major surgeries, we are going to do the ECG to provide the fitness certificate. As far as contraindications as such, there are no major contraindications as such. When the person is refusing to do the electrocardiogram, then probably we are not going to do that. And when the person is having the allergy to the adhesive used to fix the leads, in those situations, we are going to deny to do the electrocardiogram. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to have a discussion in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.